days in the rubble underneath a building in an earthquake in Haiti, and she survived by drinking all of her own urine for 15 days. This is a world record, and it's important for people to realize this, because in a survival situation, in an emergency situation, this is how people can survive, even where there's no water supply in a country, where there's no medical supplies in a country, where everything has been destroyed in an earthquake, such as in San Francisco, which we may suffer. Although San Francisco is very prepared, countries like Haiti all over the world are not prepared. And yet, if the people have the knowledge to understand how to survive in an emergency situation, then they'll be able to do what Darlene Atine did when she survived in Haiti.
I mean, I've certainly heard of people drinking their urine in emergency situations, but
right.
I've always thought it was very it was a concentrated solution, and therefore it wasn't helpful for rehydration because it's already got a lot of salt in it and urea and other things. How does it help you?
Well, what it is, it's your body produces like your body's like a computer.
Okay.
The information is put, instead of on a chip, it's put in liquid form.
Okay.
It's like, you can actually see it if you take urine and put it in a glass and let it dry out. It will form a crystalline, a beautiful red and blue and green yellow crystal on the bottom of the glass.
Okay.
And you can actually see the information right there in the glass.
Oh, wow.
Yeah,
okay.
It's information that your body is transmitting back to you.
Okay.
And so a lot of studies have been done of the different kinds of enzymes, hormones, antineoplastins, just protein, vitamins, minerals.
And people are using it for, you mentioned, for a few thousand years for treatment of like specific things. Are they like?
Yeah.
They just taking it as like straight out and straight back in again, or are they doing something with it before they?
No, they just drink, or they rub it on the skin, or they snort it.
Okay.
And they do that because the tissue in your nose and the tissue in your mouth is very close to the blood. And so as soon as you put it in your nose, the information goes into your blood, back through your system.
I've heard it's a good disinfectant, but that's about it.
You have heard.
Yes.
Oh, how is it used as a disinfectant?
I haven't tried. I don't know, but I've heard it's actually, it's not dangerous. Like people,
right.
Yeah. It's, and because of the acid in it, that it can actually potentially disinfect.
Right. See, everybody's had these kind of experiential knowledge kind of thing, where they've heard it for some reason. Yeah. So.
But I've never heard about it being used in a therapeutic sense.
So how would you use it as a disinfectant?
I don't know. If you don't have any other alternatives, and you have a cut or something, and you can. All I can think of is if you're in the woods, you need to pee on your friend.
Right. That's cool. Yeah. How about if you have athlete's foot?
I've not heard of it for athlete's foot.
During Vietnam, guys used to pee in their boots before they go
Really?
In the field, because the tropical diseases were so tough over there. And they found that it worked.
Well, I've heard of people at sea that drank each other's urine and stayed alive.
Oh, when they're lost at sea.
Yeah, better than seawater.
That's for sure.
So, there's something in there, right, that keeps us alive. But urine is not that dangerous, or what's the word I'm looking for?
Toxic?
No, it's not toxic.
Yeah, it's sterile. Okay.
Because it goes to the kidneys.
Right. It's clean. Yeah. So.
Okay.
I would go so far with like Ayurvedic, and then some things I can't do, and that's drink my own pee.
Oh, she
I
named
would.
it. She named it.
If it came down to it, I would.
So what do you think of urine therapy? Have you heard anything about it?
Yeah, I've heard a lot about it, but I mean the bottom line is that if you're excreting it because it doesn't need to be in your body, I just don't really understand why you'd want to put it back in, personally. I don't really understand that.
Why would Ayurvedic medicine be using it for 5,000 years to treat cancer?
I don't know.
And asthma.
Yeah, I don't know. But that's just how I look at it.
It's the waste products from your body, so I'd rather not have that re-enter my system.
So where did you get that information from to think it's actually a waste product? Where was that taught?
Biology class.
Biology class. Wow. Are you in college or high school?
I'm actually not in school currently.
Okay. So if you heard that it's been used as a healthcare drink for 5,000 years, would that change your opinion?
No, I've actually heard of something like that. I've heard of something similar before, but maybe.
So what were you told at school then? What did they tell you, or what did they teach you about it, that it's toxic and all that sort of stuff?
I never heard it was. It's hard to explain. They taught us that after your body processes all the things, it sends it through all your organs, and that all the waste, like all the more harmful chemicals, like are streamed through your urine and your feces.
But you've never heard of it. Like, did you go to college?
Yes.
And nobody in biology ever
I
mentioned that?
have a degree in biology. And
You have a degree
I mean,
in
I've heard of it a little bit, but we don't like discuss it as a subject.
You have a degree in biology too. Wow.
Yes.
Great.
I use it in my compost.
You use it in your
Yeah.
compost.
It's good to be in your compost pile.
Absolutely. It's got a lot of nitrogen.
Yeah.
That'll be good. And you compost and then raise vegetables
Yeah.
here in the city?
Actually, right now I live in North Carolina, but
North
yeah, we have an organic garden that we use.
Wow. Okay. So, have you ever heard of urine therapy?
Yes.
How have you heard of people using it?
It's ingredients in skincare.
Yes.
In some parts of the world, they drink it actually.
Yes. Like me, for 30 years.
Okay.
Him, for how many years? Yeah. Would you use it?
No.
If you were lost in that guy who cut off his arm, he was lost 6 days. He had no food, no water for 6 days while he was sawing off his arm.
If I could avoid it, I would, because it's stuff in there that you're excreting for a reason. So after a while, it becomes totally undrinkable. So if I could filter it in some way, yeah.
Well, you don't really have to. I've been drinking it straight for 30 years.
Okay. But you also have other liquids at the same time. You also drink
My
water.
wife asked me about that. She says, "Why don't you drink water?"
Not at all?
I occasionally do.
Oh, okay.
Mostly. I did a 9-day fast. Nothing but.
Nothing but.
Yeah.
Wow. Doesn't it get more and more concentrated each time you drink it?
It's more dilute, actually.
How does that work?
It appears to work that the body absorbs the ammonia out of it to make proteins, and the nitrogen to make proteins.
That actually makes a kind of sense. All right.
Seems to work. I don't know.
I still wouldn't. But
Yeah, I understand.
Tastes like chicken.
Fantastic.
It really doesn't have a taste. No, I mean, urine doesn't have a taste. If you've been drinking and drugging and doing everything else, and it might have a bright yellow color and a taste. But if you're taking care of yourself, it's clear, has very little taste, right?
Right. People have been using it now for 5,000 years.
For 5,000 years?
Yeah.
Really?
That's right.
Well, if people have been using it for 5,000 years, there's got to be some good reason for that.
Oh, right. Yeah. So,
I guess it's a natural byproduct of the body, and maybe there's
very good. Right off the top of your head,
there's
that's good.
extracts from different organs in the body that are
Exactly.
helpful.
Yeah, the body produces its own medicine. Whatever disease you have, the body just cranks out what are called anti-neoplastics that treat that disease. But only if you do one thing. Capture the urine and recycle it.
Okay.
It won't work just if it's in your bladder,
Okay.
which is weird.
Cool it down, heat it up, or
No,
treat
you
it?
just drink it.
Just drink it?
Yeah, fresh. The fresher the better.
My mom is in her 70s, so when she was a little girl back in Nicaragua, Central America, on the farm, they pretty much, my grandfather had people working for him, and she remembers at one time when she was like 4 years old, she had a stomach ache, and my grandfather said that to take one of the uses for urine, she remembers that he used to say that the first urines of the morning could be used for therapy, and she had a stomach ache, so he got the, I don't know whose urines, but the first urines in the morning, and gave it to her, and she said that her stomach ache went away. And
That was your mother?
that was my mother. She said she was like about Sarah.
Sarah.
So she was like, she said she was like around 4 years old, and she said she remembers that because she used to like pay attention to everything. She was really close to my dad, to my grandfather. And there were other, therapies for urine, but that's what she remembered the most, because she remembered waking up with a stomach ache, and he gave her the urine, and she said that the pain went away. And that's one of the things that he used to say, you can use the early morning urines for that type of therapy.
Right.
So, in those days they used to use all kind, like I was saying before, like there's I don't know what you guys call it over here, but sometimes you get those like a bump that looks like it's like an eye infection, a growth. It's not cancer, no, it's an infection that some people get, and it looks like it's full of pus. Well, you can use your spit the early morning before you wash your teeth.
Right.
And you put it right as it's growing. And I remember she did it on us before, and we would put it, and it would make it go away. So those are the types of therapy, those are the type of, the common the folk medicine that people used. Yeah. And even in Europe, they used to say, the folk medicine, because when you couldn't get a doctor, or the doctors were really lived far away, those are the things that people just, the wisdom of the folk, the people, and it worked, because it was something that they saw. Somehow they came up on that knowledge, and it was practical, and it worked. And so I remember that she did that, and it makes kind of sense, because there's a lot of bacteria, like I was saying, in the spit that are really deadly and bad. So I guess when you use that on that infection, it kills it, it attacks it, and it kills it, and our eyes would heal. And I mean, there was somebody here that a young girl that works here, and she got one of those. It's a bump. It's really ugly bump that you get in your eye. It's an eye infection. I forgot what you call it. But it looks like it's full of pus.
Yeah.
And I told her, I said, if you put the spit, because I remember, I said, my mom, when we used to have that as kids, we used to do that, and it really worked. And my mom says, yeah, it works, but you have to get it right as it's going. After it's grown, you just have to let it run its course, and it won't work.
Right. Yeah.
So that's my 2 little cents worth of old remedies. As it pertains to urine. Well, she, like I said, when her dad took care of that stomach ache that she had, she was 4 years old, and my mom is in her 70s. I'm 54, so I mean, she told us she told me that, she told us all that, because we would ask her about, tell us about your life, and she would say that, when we were kids, we knew about that when we were kids. We've gotten so-called, we progressed so much, and I think that the medicine as it's done today has just gotten too commercial. Everybody will tell you that. It's just like even in the 30s and even in the late 20s, the doctor would come to your house. I mean, back home, because we're a third world country, and we weren't as advanced as it was here. I remember when I was a kid and I was still back in Nicaragua, people used to say, they used to look at America like the gods. Oh, you have this? Let's go to the gods, but people, because wherever knowledge is more progressed, people look at that, and blah blah blah. But I think it's just that the corporations, the medical, the the industries that sell you medicines now, it's become a multi-million dollar industry, and there are some people who still know about these old traditions, and these are the people who are most of the time will be the poor, and they live way out in the country, still where I come from in Nicaragua. And I'm sure I'm sure that happens anywhere in the world, in Europe, where people are out in the mountains and they still remember these traditions. I'm sure they still survive. So, but I just think that for me, it's just it's become a business, not for everybody, but I think.
So what is your name?
My name is Cheiro. 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 It's a Portuguese name. It means scent, the scent of whatever.
Okay.
Yeah.
So would you ever consider doing urine therapy if you had a problem?
Yeah, I would consider doing it because I know that my mom did it, and she told me, like my grandfather, and I know that some people, even now, I think some people still do it back home. You have to. I think they knew which urines to use, which she said would be the earliest, and because they didn't have refrigeration in those days, they would try to keep it. The early morning urines, the first pees that you did in the morning. That's what she told me, because that's what she drank, and that's how my grandfather cured her stomachache when she was 4 years old. So yeah, I would do it.
To survive?
Absolutely not.
That would be easy. It's just.
So have you heard anything about other forms of people doing urine therapy for different things?
I have heard of it, but I didn't. I never learned any details about it.
What have you heard?
That people who do it are firm believers that it's helpful for whatever reason they're doing it.
So if you were diagnosed with cancer and someone told you, this is the way to go, would you consider it?
Yes, I would consider it.
And it doesn't gross you out at all?
No, I'm a nurse.
Oh, so you would have seen this.
It takes a lot to gross me out.
Okay.
But one of the things I learned in nursing is that even nurses usually have one bodily fluid that will gross them out. For some, it's blood. For some, it's urine. For some, it's mucus. But urine doesn't bother me at all.
So being a nurse, you've never heard about the practice of urine therapy then?
I've heard of it.
Yeah.
I just haven't heard any details.
Okay. So what sort of things have you heard?
That people who have learned about it and tried it for a specific condition, and obviously to start with, they had to be comfortable with the idea. They had to be willing to try it. Some people felt it was extremely helpful, and that's what I know. Not as a medication. I know that it's used in some topical things as a moisturizer, and it's a very excellent moisturizer in a topical.
The most expensive hand creams and face creams.
Right.
That's the number one ingredient when you read the label.
Right. I knew that, and I had even had that pointed out to me by a dermatologist.
Ah, a dermatologist where you work?
No, that I was seeing as a patient.
You might ask your mother. I'll bet you if you ask your mother and your grandmother about it, they'll go back, oh yeah, because I asked my mother and she said, well, I had a rash on my arm one time, and my grandmother told me this when she was a kid. My grandmother said, go out to the barn and get some cow urine and rub it on the rash and it'll go away. And she did, and it did. So
There you go.
yeah.
Urine therapy.
Yeah, well, they use it now for protecting bees against the disease. Do you have beehives in your farm?
No.
In North Carolina?
No, we don't, but
You're
we have a
thinking of
friend that
getting
does.
bees?
Yeah, we're actually planning on it this spring.
Ah,
Yeah.
on YouTube you could go and look at, in India, they've got research on using cow urine to protect bees from the mites. And they just spray it on the hive and it kills the mites.
Cool.
Yeah, it's a big deal in India.